Let's practice some Ortho OSCE questions. So question number 1. What is the injury and what are the fixation device used? So in this we can see there is the comminuted fracture of the tibia. Here tibia is fractured and here some wire is introduced into the fibula. So what is the injury? So there is the comminuted fracture. So comminuted fracture of the distal tibia and the fibula. And what are the fixation device used? Here we can see this nail used in the tibia and fibula. So the intramedullary interlocking nail in the tibia and Ross nail in the fibula. Question number 2. What is the injury and what is the most important complication? Here we can see there is dislocation of the shoulder joint. So shoulder dislocation. What is the most important complication in shoulder dislocation? The axillary nerve get injured. We perform the regiment badge test for the shoulder dislocation, in which there is anesthesia of the part which is supplied by the axillary nerve. So question number 3. What is the injury and what is the name of the cast? This is the humerus. We can see that there is the middle third of the humerus is fractured, and this is the oblique fracture, and it is making the angle more than 90 degree. And the cast used is the hanging cast. This cast used is the hanging cast. U cast is U cast and the hanging cast is used for the fracture of the humerus. What is the disease and what has been marked by the arrow? Here we can see the dead bone sequestrum. So this is the chronic osteomyelitis. In chronic osteomyelitis, sequestrum is seen, and what has been marked by the arrow? The arrow, we can see the sequestrum. So question number 5. What is the fracture? How has it been managed? Here we can see this lateral condyle is been fractured. So fracture of the lateral condyle of the humerus. So it is managed with, here we can see the 2 K wires. So closed reduction and fixation with percutaneous with 2 K wires. We can see here 2 K wires, 1, 2 K wires has been used for the fixation of the lateral condyle fracture of the humerus. What is the disease and how do you treat it? In metaphysis, we can see the cupping, splaying, fraying. So this is the rickets, and in rickets, which occurs in the children, there is deficiency of the vitamin D. So vitamin D is given to treat this condition. Question number 8. What is the diagnosis and what has been marked with the arrow? Here we can see the periosteal reaction, which is seen in the osteosarcoma, and this arrow shows the Codman's triangle. So this is the osteogenic sarcoma of the femur. Osteogenic sarcoma is the osteosarcoma, and the Codman's triangle has been shown. Question number 9. What is the diagnosis and what is the causative organism? Here we can see this is the spine, and the spine has been eaten by the microorganism. So this is the tuberculosis of the spine, and the causative organism is the Mycobacterium tuberculosis. Question number 10. What is the name of the splint and is it fixed or sliding traction? Here we can see that part of the body is used only as the counter traction. Only part of the body is used as the counter traction. So this is the fixed traction, and this is the Thomas splint. In sliding traction, the whole body acts as the counter traction. Question number 11. What is the condition? This is the winging of scapula, and which nerve is involved? Long thoracic nerve of Bell is injured. Question number 12. Here we can see the supracondylar fracture of the humerus, and the what are its types? Flexion type and the extension type. Extension type is the most common, 90%, and the mechanism of injury for the supracondylar fracture of the humerus is the fall on outstretched hand. Question number 13. So again, this is the shoulder dislocation, and one of the method of the reduction for shoulder dislocation, there is Kocher's method, in which we perform the traction. Perform the traction, external rotation, abduction and internal rotation in Kocher's method. Then there is Hippocrates method, in which the doctor's foot is put in the axilla and the reduction is done. And the third is the Kocher's Hippocrates, and the third is the Stimson's gravity method. The reduction is reduced, the dislocation is reduced under gravity. Question number 14. What is the diagnosis? This is the Dupuytren's contracture, and this is associated with the Liederhorst disease. In Dupuytren's contracture, there is the contraction of the ulnar side of the palmar aponeurosis, DUP. So ulnar side of the palmar aponeurosis gets contracted. Here we can see this is getting contracted. Question number 15. Identify the above instrument. This is the periosteal elevator, and it is used to elevate the periosteum. What test is being performed, and for which disease condition this test is performed? Barlow test. For the developmental dysplasia of the hip, two tests is performed, Barlow test and the Ortolani test. In Barlow test, adduction is done at the rate BAD. We can remember that. In Barlow test, adduction is done. This is the provocative test. This is the Barlow test. This is the method in which we dislocate the joint, but in Ortolani test is performed for the reduction. Question number 17. Above dotted line is in the picture is this dotted line is the sentence line, which is formed. This is the obturator foramen, so which is formed above the imaginary line, which is formed above the obturator foramen, superior of the obturator foramen, and this is the neck of the femur and the inferomedial border of the neck of the femur. Sentence line, and disruption of this line signifies dislocation. This line is disrupted in the developmental dysplasia of the hip, in some dislocation, in fracture. Identify the above implant and give its use. Here we can see the threaded part in the center. So this is the Denham's pin, and it is used as the skeletal traction in the cancellous bone. In question number 19, the above deformity is shown as, this is the gun-stock deformity, which is the cubitus varus, which is seen in the supracondylar fracture of the humerus, which is the commonest complication of supracondylar fracture of the humerus. Question number 20. The above picture shows, this is the axillary crutch and this is the elbow crutch. Name the hand deformity. Here we can see the claw hand. This is only the partial claw hand. So the which nerve is involved is the ulnar nerve. In complete claw hand, median nerve is also involved. So in complete claw hand, ulnar nerve and the median nerve is involved. Identify the above instrument. This is the chisel and this is the osteotome. Chisel is used to cut the extra bone. So remove the overgrowth. Remove of the overgrowth. And osteotome is used to cut the bone. This is the Froment sign. Which test is being performed and for which nerve is this test being performed? This is the Froment test. This is done for the ulnar nerve and to check for the adductor pollicis muscles.